and TMAC, the Texas Multicultural Advocacy Coalition. And of course, I have my very dear friend and colleague, Congresswoman Garcia, who will be speaking as well. I am grateful to the press for being here because this is an important message that we need to get to the masses. There are some things that are happening that we find unacceptable. I shall go through some of them, and my friends will give additional commentary to the extent that they desire. But under federal law, hospitals must provide emergency care regardless of one's immigration status. Medicaid payments are allowed for undocumented persons in need of emergency care who, but for their immigration status, qualify for Medicaid. I have some questions that I'll ask of the governor. The first is, why didn't the governor accept the $100 billion appropriated by the Congress of the United States of America for Medicaid for the state of Texas? 41 of the states have accepted it. 41 other states have accepted it. The governor has not. 17% of the uninsured in Texas are without health care, of course, and that would be about 4.9 million people. According to news reports, this is the highest number of uninsured persons in our country. It is unfortunate that our state, the great state of Texas, has the highest number of uninsured persons in the country. This action appears to be a part and parcel to the governor's two-step simplistic immigration reform program, a program that is calculated to keep them out with a wall and kick them out with a roundup and removal from the country. Aside from the legitimate questions related to those seeking asylum and the constitutional questions associated with a show me your papers roundup and removal from the country, there are some practical questions associated with the benefits undocumented persons provide our country. Question 1, how will the governor perfect his removal program? How will it be done, given that persons are not required to show papers to get emergency health care? Interesting for the governor to answer the question, but as you do so, Governor, I'd like to know how the removal of approximately 41% of the farm workers who are undocumented affect our economy. There is a plan being put together now to round up and remove persons from the country. We've heard it from the highest office in the land in the sense that this person is seeking it. He once was president, he is now seeking the presidency again, and he is the nominee of the the Republican Party, and he's seeking this office, and he desires to round up and send persons out of the country. The governor is a part of this plan. Next question, how will the removal of approximately 19% of the maintenance workers who are undocumented, work long hours, for low pay, and with few benefits, how will this impact our economy? Next question, how will the removal of approximately 15 to 20% of the undocumented construction workers who build homes and infrastructure impact our economy? How will the removal of 10 to 15% of undocumented food preparation service workers impact our economy? And how will our economy be impacted by the removal of undocumented workers who pay tens of billions in federal, state, and local taxes, including personal income taxes, property taxes, sales taxes, and gasoline taxes, many of whom are barred from receiving the social services their tax dollars support, including health care? How will removing them impact our economy? This is about more than just the health care that's being provided. When you try to remove people who are working hard, have an emergency, need health care, and cannot get it simply because they believe that going to the hospital to get that care might cause them some harm beyond that of which they already have. Many people will wait until there is a true emergency before they go, and then when they go, they're going to have to prove to somebody that they are here, documented or undocumented. What if the person can't do that or declines to do that? How will the governor enforce this law? This is a law that I believe is unconstitutional. It is his order, of course, executive order, but I believe this executive order is unconstitutional. And I'm going to stand to fight the executive order because in an emergency, every person deserves to get health care, deserves to get it immediately. If you're unconscious, if you're comatose, you deserve to get health care without having to say a word. In this country, if we should harm you while you're robbing a bank, we're going to give you aid and comfort, and that includes health care. In this country, if we harm you while you're an enemy combatant, we're going to give you aid and comfort, and that includes health care. Hardworking people who are undocumented deserve health care in this, the richest country in the world, and they deserve it without having to show papers or sign papers. I will now yield to my colleague, the Honorable Sylvia Garcia, for her comments.
Thank you, Congressman, and my friend, and to all the people at the podium. We're here to just say something to the Governor Abbott. Take care of people. Put people over your politics, especially our children who are the future. Look at the skyline here. This is the Texas Medical Center. It's known worldwide. People from all over come here. And we're going to now try to tell immigrants that are residents and are productive citizens of our area that no, you can't have health care here, because that's what's going to happen. This order that tells them to keep track of the services that they're providing, because he wants to find out how much money is going to providing this health care for immigrants. Why is it that all of a sudden he cares? Think about it. He's not expanded Medicaid, which would serve millions, I think it's about 1.5 million people in our state. When you look at the list of the states that have the worst uninsured rate, Texas is number one.
That's right.
When you look at the number of uninsured by district, congressional district, I'm number one. My area, 77% Latino. We're probably the greatest congregation of immigrants probably live and work and contribute to our society, is number one out of the 435 council districts, congressional districts. And I'm not alone. If you look at the top 10 of all in the country, the top 10 are all in Texas. I'm number one. I think Congressman Green is number 6. But Congressman Castro, we're all on that list because the governor refuses Medicaid. But if these children that don't get Medicaid may end up on the front steps of one of these institutions. And we're finding that the Trump era proposals, when Trump imposed the public charge rule, it made a chilling effect on people applying not just for Medicaid, but for many other programs. That a recent study found that nearly a quarter of adults in mixed status families were still avoiding these programs last year because of this Trump era public charge proposals. 47% of eligible immigrant children were enrolled, compared with 86% of eligible U.S. born children. Huge difference. Why? Because the parents still are afraid. They know their public charge rule may be gone, but they're not quite sure. It impacts a lot of programs. So the fear is real. These children would be able to be enrolled in any other situation. And let's not forget that a lot of this is because Abbott wants to focus, as the congressman said, on his Operation Lodestar, which in my view has been a total waste of $11 billion from this state since that operation started. Putting up razor wires, sending immigrants across this country on buses, the border wall. He finds every way he can to zap more of our public dollars for another political stunt. This is just another political stunt. I thought he was applying for the office of vice president under the Trump administration. Maybe now he wants to be in the AG's office. Who knows what he's applying for now? But clearly, this is something that is being done to appease the MAGA Republicans and to make him the national star that he wants to be. He needs to focus on Texas, Texas's children, in the future of the state, and that's what making sure that people are healthy, that they can go to work, they can get a decent pay, and that they can keep their families together. So he needs to rethink this whole thing. He had to withdraw his order, because I do not think it will stand up to constitutional challenges. The federal law is clear. You cannot deny emergency services to anyone that presents themselves regardless of immigration status. That does not change. Abbott's order is unconstitutional. With that, I yield to...
I'm going to announce all
Okay,
the following
okay,
persons.
okay,
since you don't
okay.
mind.
No worries, I didn't.
Okay, next we'll hear from State Representative Jean Wu. Thereafter, we will hear from Dr. Lira with the LULAC. Thereafter, we will hear from Dr. Pei, who's representing the Texas Multicultural Advocacy Coalition. Representative Wu.
Thank you so much, Congressman Green. My name is Jean Wu. I'm Texas House District 137 in the state legislature. I'm not going to talk about the stuff that already been talked about, that Texas has the highest uninsured rate in the entire nation, that Texas has one of the absolute worst maternal mortality rates in the entire United States, one of the worst infant mortality rates in the entire United States, the absolute worst mental health care in the United States. We're not going to talk about that. We're not going to talk about the fact that Governor Abbott has intentionally, purposely made sure that we do not expand Medicaid and accept the Affordable Care Act in Texas, making health care much more unaffordable in this state for all people, all working families. Instead, what I want to talk about is this, that this order will directly affect Americans, will affect American citizens, will affect all people who are immigrants. We have done this before. We have sent similar orders like this before. We have sent them from the White House, we have sent them from the governor's office, and what we have seen time and time again is that American citizens who are immigrants will fall for this. That people who are lawfully here, people who are in my community, in Congressman Green's community, in Congressman Garcia's community, people who are lawfully here, people who are American citizens, people who are refugees, people who are lawful immigrants, will refuse to go to see a doctor because they are scared, because they don't understand, because they don't know what the governor's order actually means. They don't understand that this is just a political game that he's playing. But he's playing it with people's lives. When we talk about that Texas has 30 million people in it, even if a tiny, tiny fraction don't go see a doctor on a preventable disease, don't get their diabetes treated, don't deal with an emerging heart issue, we all pay for that. They have children who need to be taken care of. They have jobs that need to be done. They have income that needs to be brought home. And when they get sick because of a preventable disease, when they die because they were scared to see a doctor, that's on Governor Abbott. That's on all Republicans who will support this and who have pushed these type of agendas, because we know that with Trump, with Project 2025, that this is now a war. This is a war on immigrants. This is a war on the American dream. And this is a war on all people of color, all people who would desire to seek refuge in this nation, all people who seek safety, who seek peace, who seek freedom and liberty. This is un-American. This is un-American. We can have national immigration laws. We can change them, we can modify them, we're going to reform them. But we don't say to people, just go die in the street.
Good afternoon, everyone. I'm Dr. Sergio Lira. I'm president of Greater Houston LULAC, vice president of TMAC. Here we go again. The political piñata with immigrants in this country. This is just another example of the litany of anti-immigrant legislations that being passed here in the city, in the state, and is very similar to another state that's on the other side of the South. However, let me remind Governor Abbott a little something historical. At the turn of the century, when a lot of mostly white Europeans were coming across the ocean, they were saying, Give me your poor, give me your hungry, give me your huddled masses. But why have we turned our backs in the southern border? Why have we done and not given them the opportunity as their ancestors, and perhaps children of them themselves are now benefiting from the struggles of minorities in this country? Let me just say that 63% of the labor force in the construction labor force are Latinos. Of those 63%, 40% are immigrants. And of those 40%, 72% are undocumented. Did you know that immigrants pay $26.3 billion in federal taxes? How? ITN, the identification tax number. There are many undocumented folks who pay into our federal coffers. Undocumented immigrants, this legislation is targeted to a very specific group, the undocumented immigrants, who folks think that they're ripping off this country, that they're invading us, but they contribute more to the coffers in state, federal, local taxes than the benefits they receive. Undocumented immigrants pay $2.6 billion in federal taxes, $1.6 billion in state and local taxes. This is a lot more than the $80 billion that was wasted by Centerpoint on useless generators. And finally, Latinos contribute $52 billion to our Houston economy. So let's just look at it in the most simplistic way, in a realistic way. We have a labor shortage in this country, and I want you to think right after Beryl, who was fixing the fences? Who was up on the roof? Who was out there picking up the debris? Not the Centerpoint line folks, which we appreciate. They came in after 9 days. We appreciate them. But I'm talking about the folks in the real life, folks that are exploited in this country, folks that are feeling the labor shortage in this country. Yet, we want to deny them and their families health care. It's a federal right. It's a constitutional right. And again, we're going to waste taxpayers' dollars, our federal colleagues, challenging these anti-racist political executive orders. Thank you. Muchas gracias.
Hello, I'm Dr. Stephen Pei. I'm a professor at the University of Houston. I'm here today representing the Texas Multicultural Advocacy Coalition. It's a coalition of Black, Latino, and Asian. We are the primary victim of this bill just signed by Governor Abbott. I think Asian has been labeled as the model minority, but don't forget, we have plenty of Asian working in Chinatown, working at the bottom of the society. They need medical help. But let me take this one to one level, much more personal. I came to the U.S. over 50 years ago. I'm a U.S. citizen. But if tomorrow I am in a medical emergency, I'm not conscious, I don't have any document with me, am I going to be treated by the hospital? I'm worried about not just for the undocumented immigrants, I worry about myself, my children. I think that's where we are. We are keep pushing out these anti-immigrant laws or bills or orders. Keep in mind, after the 2 World War, the immigrants from Europe really bring the American university to the top of the world competitiveness. After World War II, the Asian immigrants really bring the American high-tech competitiveness.
That's right.
Even today, we talk about artificial intelligence. Do you know more than 50% of the top artificial intelligence researchers are from China in this country? If we cannot maintain meaningful, helpful immigration policy, we are shooting ourselves not just at the foot, we are shooting ourselves somewhere very close to our head. Thank you.
All right.
In summary, We are here in the Texas Medical Center because this is a problem that confronts the patients as well as the doctors. Because at some point the doctors are the ones who have to acquire the data that the governor has requested. And we want the doctors to know that we're going to stand with them to protect them from whatever penalties the governor may think should be imposed. Because the truth is, in this country, emergency health care as a matter of law is available to persons regardless as to whether they are documented or undocumented. And it's important for us to note that these persons, many of them, are going to now be put in a position where they may not get the health care that they need and that they deserve and that their tax dollars may be paying for because they do pay taxes,
That's right.
Federal, state, and local taxes.
That's right.
So let's not call them deadbeats. Let's not look at them as people who don't deserve health care. Let's look at them as human beings in the richest country in the world, where we pride ourselves in taking care of people who need health care. Health care for all is really what I stand for, but today I'm here to protect health care for those who need emergency care. And I yield now to those who would ask questions.
Have you considered
Can't hear you.
Gerald Malcolm's have you considered filing some legislation that will protect immigrants from this sort of executive order?
Yes, the question was, are we considering legislation to protect persons from this type of executive order? I will speak for the federal side. I hope to file legislation that can preempt an executive order such as this in Congress. The Congress has already, by virtue of law, indicated that health care is to be afforded persons in an emergency situation, regardless as to your immigration status. We need to add to that an addendum that says regardless of your immigration status and without having to give your immigration status, people ought to just get health care if there's an emergency and not have to fill out papers. Do you have something to say?
And I think, look, we spent all this time passing HIPAA, right? The Health Information Act, like basically saying like we want our health information to be private because that is private to us. And now Governor Abbott is asking the hospitals to do the complete opposite. Take what is private and push it out into the government. That's the exact opposite of what HIPAA was intended to do. HIPAA does not want anyone's personal information that was received during healthcare to go out to the government. And we're now going to do the opposite.
All right, another question?
For Representative Wu, you guys are preparing for the legislative session next year. What are your thoughts on this executive order and potential
So,
action?
this executive order is just the tip of the spear of what they have done and what they will do. We've spent $10 billion on a theatrical play down at the border to put on a kabuki theater to show how awesome it is and how much the government cares that it's concentrated on one tiny spot on the border. And at the same time, what the governor is preparing for, what Republicans are preparing for in 2025 are the plans of 2025. And that is to go after all immigrants. This is the tip of the spear. What they have planned in the future includes banning Asian Americans, banning Chinese people from buying homes, buying commercial property, buying farmland. They're planning to ban people from attending university, ban people from having jobs, ban Asian Americans from working in the hospital district, ban them from working in tech, ban them from working at NASA. This is the beginning of Trump's anti-immigrant wave. It has already come. We have already seen the beginnings of it. This is the crest of the wave. This is the big part of the wave that's coming, and we expect more behind it, and we will fight. Our communities have to come out and vote, and we have to come out and fight, whether you're a citizen, whether you're undocumented, whether you're a refugee. Everybody needs to come out and fight for their communities, because this is a war against all people of color, against all immigrants, against anyone who does not look like Governor Abbott.
Let me just add. just
Please.
I just want to add something. State Rep Gene Wu mentioned Project 2025. If you read it, and you read the early Nazism manifesto, there are some strong similarities when you're fighting for a nationalism country, very similar to the early Nazisms of Germany. But I just want to say one thing, and that is Martin Luther King said it perfectly. When we all are older, and we're almost there, but as we get older, we're going to remember one thing. We're not going to remember the words of our enemies. We're going to remember those who remained silent. Silent when we knew perfectly well that there was evil legislation proposed and passed. And we will no longer stay silent for the most vulnerable, undocumented immigrants who have no voice, who are unable to vote. However, keep in mind that if they're going after them, who are they going after next?
And let me close with this, if I may. It's important to note the $100 billion that Congress appropriated for Texas. That's $1 billion, not 100 million, appropriated for Texas. Why? Because the governor is indicating that the Biden-Harris administration should have to pay for the emergency medical care. Well, if the governor had accepted the $100 billion, some of that $100 billion could be used for the very thing the governor is complaining of. The governor is creating an issue for political purposes. You should not play politics with health care. That's what the governor is doing. And just as I had a bill presented to deal with those laws that would somehow prevent persons from another country from buying property in this country, we preempting it at the federal level. We're going to preempt what he's trying to do with this executive law at the federal level. Governor, you're wrong. You're not standing with the people. You're standing with the politics.
That's right.
Thank you, everybody. You want to get out the sun now?
Yes.